This is the fifth in a series on bad therapy. That is, things that therapists do on purpose, not by accident, that are actually harmful or don't help the process of therapy. Today I'll talk about a topic that's discussed a lot more than it seems to be understood, and that is boundaries in therapy. Why do we have boundaries in therapy? What are they for? Are they required? Are they optional? What's a boundary violation and what does that mean? That's what we'll talk about today. I'm Dr. Stephen Reidbord. I challenge oversimplified or misleading messages that infest social media, including here on YouTube. If you like what I'm doing here, please like this video and subscribe to More Than Meds. Licensed therapists work within certain boundaries. These in training are usually first introduced as do's and don'ts, rules that therapists have to follow in order to practice ethically and to avoid lawsuits and so you don't lose your license. But thoughtful training goes much further and goes beyond the rules and the do's and don'ts and emphasizes how boundaries are essential to do good clinical work, that they're part of the process of psychotherapy. They're not there just to avoid getting in trouble, but they're part of what allows therapy to take place. Boundaries are part of a more general concept called the therapeutic frame. It's the safe, predictable container in which psychotherapy takes place. At one level, the need for a safe container is kind of obvious. You wouldn't talk about personal, shameful matters if you thought that it wasn't going to be kept confidential, or if you thought that the therapist was going to exploit it or use it against you or make fun of you. Some of what goes into that frame, that container, is simple consistency, knowing how long your therapy sessions will last, or that the fee, the charge will be the same every time. It won't vary in an arbitrary way. But much of it is also boundaries, knowing that the therapist will talk to you, but they won't try to touch you or try to have sex with you. We'll talk about that in this video up here. That they'll encourage you to talk, but they won't force you to talk. That they won't check up on your story by doing detective work behind your back. Those are boundaries on the therapist's behavior that makes therapy safe for patients or clients. But there are other safety boundaries too. Clients can talk about just about anything in therapy, and often strong feelings get stirred up, so there needs to be a boundary on behavior. You can talk about how angry you are using any words you choose, but you can't express that anger by destroying the office or by physically threatening the therapist. That's a boundary. Boundaries are there for the safety of both parties. You won't be allowed to bring weapons to the therapy office, for example, and a therapist won't work with you if you stalk them outside of the office or try to wreck their private life. Other boundaries aren't about safety, but about making therapy work. Most therapists, for example, won't work with you if you arrive to the session drunk or stoned. This is a little debatable, but for the most part, we therapists feel that someone who's intoxicated can't really bring their full selves to a therapy session. They can't think deeply about themselves under those conditions. And they're not really expressing their natural feelings under those conditions as well. So therapy doesn't work very well under those conditions, and we set a boundary to preserve the functioning of therapy. We also set limits on things like dual relationships, having two different kinds of relationships with the same therapist. So we can't really be your therapist and your personal friend or your next door neighbor or someone you socialize with on a regular basis. Imagine how that would work. I'm mad at my therapist, but I can't really tell them because they're also my tennis partner and I don't want to lose them as a tennis partner. For the most part, it's the therapist's explicit job to set boundaries to keep therapy safe and effective. The reality, though, is that both parties set boundaries on themselves, their own behavior, and on the behavior of the other person that they're working with. When either party oversteps a boundary, this can be serious or not. In a lot of the professional literature about boundaries, there's a clear distinction that's made between what's called boundary crossings and boundary violations. The former, boundary crossings, are described as being more minor, and they can be repaired and they can be discussed in therapy. Sometimes they're actually even advantageous or helpful, whereas boundary violations are more severe, kind of irreparable, you can't fix it. Oftentimes they can't even be discussed in the therapy because the therapy's been completely ruined. And of course, for that reason, they're never helpful. I personally think this makes too blunt a distinction. That's too black and white. Whether it can be discussed in the therapy depends on the two people involved, whether it can be repaired or whether it's totally destroyed the treatment. That's often hard to say. And things are even worse when it comes to the memes on social media. You get the impression that people talk about boundaries in one of two ways. Either they're very strict about it and they talk about boundaries like very hard and fast rules that are there purely to maintain safety, and that anybody who questions them is threatening safety in therapy. And then you get people on the other extreme who look at boundaries as kind of an old-fashioned tradition in therapy that modern, open-minded therapists can casually dispense with because they're not needed at all. Both of those views are just wrong. Certainly some boundary violations are clear-cut. A patient who brings a loaded gun to a therapy session is not going to be invited back. That's the end. A therapist who tries to have a physical relationship, tries to have sex with their patient or client, has permanently ruined the therapy. There's no recovering from that. And likewise, a lot of boundary crossings aren't very debatable either. If either party extends the session for 10 minutes, even over the other one's objections or misgivings, that's not the end of the therapy. They can meet the next time and talk about what happened. They can try to understand where each person was coming from. That's a boundary crossing, but it isn't going to destroy anything. Likewise, if a therapist in a moment of strong emotional reaction to the patient, what we call countertransference, says something that in haste, they raise their voice, they make an off-colored joke because they're nervous, they offer a bit of advice that they immediately regret having given. Again, that's a boundary crossing that the two of them can discuss, that they can work past, they can potentially even learn from. Boundary crossings of that kind, it may surprise you, actually can move therapy forward in unanticipated but positive ways. For example, it can make both people conscious of getting sucked into a kind of dynamic that the client recreates repeatedly in their everyday life. And the therapist has gotten sort of sucked into that as well. But if both of them can step back and talk about it and realize that happened, it can illustrate a dynamic that happens in the patient or client's life that doesn't serve them very well. Technically, we call that a transference, countertransference enactment. But the point is, some small boundary crossings are actually a plus and can shake things up a little bit in therapy in a good way, help both people see things in a new way. But look, there's a ton of examples of things that are not clear-cut, terrible boundary violations and are not innocuous and maybe helpful boundary crossings. I was in a discussion not too long ago with a small group of very experienced psychotherapists, and they expressed to me that they would not work with a patient or client who was expressing violent or sexual fantasies about them as the therapist, but doing it in a kind of sadistic, gleeful way that was intended to scare them. For example, a client that's not matter-of-factly reporting that they have a violent or sexual fantasy about their therapist, but is talking about it enthusiastically and with passion. They said they'd feel threatened and unable to work under those conditions. That for them, one boundary of doing therapy is that sadistic fantasies gleefully expressed towards the therapist is out of bounds, that they can't really work with that. In contrast, while I recognize there are limits to what any therapist can or has to put up with, my own boundaries for something like that are wider than that. Just speaking for myself, I feel that I can work with anybody's verbal expressions of feelings, including those kinds of sadistic fantasies, as long as they stay verbal. Now, I won't just listen to literal threats. If someone says they're going to kill me after work today, I'm going to call the police. I'm not going to just listen to that because that is a threat of behavior. That's not just words. But if they tell me how wonderful it would feel to throw me down the steps or to cut me up into little pieces or to torture me physically, as long as they're telling me about it and I don't feel they're actually going to be able to do it, I can sit and listen to that. I kind of figure it's part of the job. As I see it, many patients are so terrified, so scared of their own inner rage and aggression that it's really very therapeutic to have a container, therapeutic frame, a setting, and a therapist who can withstand and tolerate that. In being able to withstand that and not being overwhelmed or terrified by the patient's thoughts and feelings, they may come to feel better about themselves, that they're not so toxic inside or unlovable or inhuman. I use this example to emphasize that boundaries are very important. They're essential, really, in therapy, and yet they have to flex for the people involved. People have different levels of risk tolerance. They have different levels of what they count as safe. And they have different sense of what allows psychotherapy to work. Patients set their own boundaries on what they're willing to talk about in therapy, what they're willing to say. And patients also set boundaries on what therapists can ask or say in therapy. If the therapist violates those boundaries, the patient will quit, they'll leave. We psychotherapists set boundaries on ourselves regarding the way we will interact with clients as well. We're all setting boundaries on ourselves and on other people all the time, often without realizing it. This recalls a well-known book by Sigmund Freud, written in 1929, called Civilization and Its Discontents. And in that book, he talks about how we're only able to get along with each other, we're only able to have a civilization because we repress, we hold back the sexual and aggressive urges that we would otherwise be driven to have naturally. We may be driven to have sex with the next person we see or to kill them in a rage, but we don't. And that allows us to get along with each other. Freud's point is that we do much of that completely unconsciously without thinking about it. But it's also true that we do a lot of it consciously. We do it on purpose so that we can get along with each other in life generally, and in that precious, trusting relationship called psychotherapy. Please comment about boundaries in therapy. Let me know what you think. And also let me know about other bad therapy you know of, misguided messages or practices that psychotherapists do that don't help the process of therapy. I may put it in a future video. Please like this video, but only if you really like it. Also, if you're inclined to share this video with others, I'm not going to stop you. Please subscribe if you have not already. And this video is part of a playlist on bad therapy, and there's a link to the playlist. Thanks for listening, and I'll see you next time.